Welcome to Wellness After 50. If you're over 50, your health is your most valuable asset. Today, we'll discuss 9 concerning but subtle signs that may appear a month before a heart attack. These symptoms are often ignored, dismissed as fatigue, age, or stress. But early recognition of these signals can save lives. So, be sure to watch the video until the end. You'll learn what to look out for to prevent trouble in time. Take care of yourself and your loved ones. Now, let's get started. Sign number 1, unusual fatigue. The camera focuses on the host, calm but alert tone. Have you ever felt so tired that even small tasks, like climbing stairs or making tea, seem like an insurmountable challenge? This constant, unexplained fatigue could be one of the first signals of an impending heart attack. Why does this happen? Your heart is a powerful pump that should constantly supply your body with blood and oxygen. But when the coronary arteries begin to narrow due to cholesterol buildup, the heart has to work much harder. As a result, the body directs blood to vital organs, leaving muscles and other tissues oxygen-deprived. This causes the feeling of exhaustion. How to distinguish dangerous fatigue from regular fatigue? It doesn't go away after rest. Even if you sleep well, you still feel drained. It gets worse throughout the day. For example, in the morning you feel fine, but by noon you're completely exhausted. It's accompanied by other symptoms: weakness in the arms and legs, dizziness, or shortness of breath. When should you be concerned? If fatigue appears suddenly, persists for several days without a clear reason, like work overload or lack of sleep, and is accompanied by shortness of breath or chest pain, seek medical attention immediately. What to do? Pay attention to other possible symptoms. Your body may be sending additional warning signs. Keep a wellness diary. Record your fatigue levels, diet, and physical activity. This will help the doctor make an accurate diagnosis. Get a medical checkup, especially if you have risk factors, high cholesterol, hypertension, or a family history of heart disease. Remember, your body is warning you about a problem in advance. The key is not to ignore these signals. Sign number 2, shortness of breath. Even with light activity, do you notice that you get winded after climbing the stairs or taking a short walk, something that didn't happen before? Or is it hard to breathe even when you're at rest? Shortness of breath is one of the most alarming signs that your heart may no longer be keeping up with its workload. Why does this happen? When the heart muscle becomes weakened due to narrowed arteries or early-stage heart failure, blood stops circulating properly. The lungs don't receive enough oxygen, making it harder for the body to maintain normal breathing. How to distinguish dangerous shortness of breath from regular shortness of breath? It occurs even with light activity, like slow walking or climbing a few steps. It doesn't go away after rest. Even when sitting or lying down, you may still feel out of breath. It might be accompanied by a feeling of pressure in the chest, dizziness, or weakness. When should you be concerned? If shortness of breath becomes persistent, worsens at night or when lying down, and is accompanied by swelling in the legs and ankles, it could be a sign of developing heart failure. In this case, you should see a doctor immediately. What to do? Don't ignore the symptoms, even if they appear intermittently. Keep track of when you experience shortness of breath, at rest, after eating, or during walking. This can help the doctor pinpoint the problem. Check your heart. Get an ECG, stress test, or other examinations as recommended by your doctor. If shortness of breath occurs without any clear cause, It's not just age or fatigue, but a signal of possible heart problems. It's better to check your health than to miss an important issue. Sign number 3. Chest pain or discomfort. One of the most well-known signs of heart problems is chest pain. However, before a heart attack, this pain may not be sharp or obvious, but instead may feel like discomfort, pressure, or burning. How does it feel? A feeling of heaviness, tightness, or burning in the center of the chest. Pain that radiates to the neck, shoulder, back, jaw, or even the arm. Discomfort that intensifies with physical activity, but goes away at rest. A sensation similar to heartburn or heaviness after eating, but not related to food intake. Why does this happen? When the coronary arteries narrow due to cholesterol plaques, blood can't flow freely to the heart muscle. This causes ischemia, oxygen deprivation of the tissues, which manifests as pain or pressure in the chest. When should you see a doctor immediately? If the pain lasts more than a few minutes or comes back. If it occurs at rest. If it is accompanied by dizziness, weakness, nausea, or shortness of breath. What to do? If pain appears suddenly and doesn't go away within 5 to 10 minutes, take nitroglycerin, if available, and call emergency services. Don't ignore even mild but recurring chest pressure. It could be an early warning sign of a problem. Schedule a checkup, ECG, blood tests for cholesterol, and an ultrasound of the heart can help assess your risks. Pressure or burning in the chest is not just fatigue or age-related changes. Even mild discomfort in this area could be the first sign of an impending heart attack. It's better to be safe and check your heart in advance. Sign number 4. Sleep disruptions. If you've been having trouble falling asleep, waking up frequently at night, or feeling anxious before bed, it may not just be stress or age-related changes, but an early sign of heart problems. How does this manifest? Difficulty falling asleep, even when you're tired. Frequent waking at night for no apparent reason. A feeling of anxiety or restlessness before sleep. A sensation of shortness of breath at night, especially when lying down. Waking up tired, even after a full night's sleep. Why does this happen? Before a heart attack, the body undergoes hidden stress, even if the person doesn't realize it. Blood circulation disruptions, lack of oxygen, and fluctuations in blood pressure can affect the nervous system, leading to insomnia, anxiety, and restlessness. When should you be concerned? If sleep problems appear suddenly and persist for several weeks. If poor sleep is accompanied by fatigue, shortness of breath, or chest pain. If you wake up exhausted, even after a full night's sleep. What to do? Pay attention to other symptoms. Your body may be sending additional signals. Try keeping a sleep diary to track changes. See a doctor if insomnia becomes chronic and is accompanied by other concerning symptoms. Sleep disturbances don't always mean heart problems, but if they appear along with other symptoms, it's a reason to get checked out. The body rarely signals without reason. It's important to listen to it on time. Sign number 6. Dizziness and near-fainting episodes. If you suddenly feel dizzy, weak, or experience darkening of vision, it could be a sign of circulation problems and potential heart issues. How does this manifest? Sudden dizziness for no apparent reason. A feeling of imbalance, especially when standing up or walking. A feeling of emptiness in your head, or foggy consciousness. A weak spell where you feel like you're about to faint. Ringing in the ears or temporary vision impairment. Why does this happen? The heart is responsible for delivering oxygen and nutrients to the brain. If blood flow is disrupted due to narrowed arteries or irregular heart rhythm, the brain doesn't get enough oxygen, causing dizziness or near-fainting spells. When should you be concerned? If dizziness comes on suddenly and happens frequently, if it worsens with physical activity, if it's accompanied by nausea, sweating, chest pain, or rapid heartbeat. What to do? Sit or lie down if you experience dizziness to avoid falling. Measure your blood pressure. Sharp fluctuations may indicate heart problems. Note when dizziness occurs and discuss it with your doctor. Get heart and vessel checkups and blood oxygen level assessments if these symptoms happen regularly. Dizziness can have various causes, but if it's accompanied by weakness, sweating, or chest pain, it's a concerning signal of potential heart issues. Don't ignore such symptoms. It's better to check your health in time. Sign number 7. Increased sweating without an obvious cause. Have you noticed that you suddenly start sweating a lot, even when it's cool outside and you're not engaged in physical activity? If this happens regularly and is accompanied by other symptoms, it's worth paying attention. Why does this happen? Before a heart attack, the body may experience stress due to a lack of oxygen and poor circulation. As a result, the sympathetic nervous system is activated, causing sudden excessive sweating. How to distinguish dangerous sweating from normal sweating? Sweating appears suddenly and is not related to physical activity or heat. It is accompanied by clammy skin, chills, or a feeling of anxiety. Excessive sweating occurs even while resting or at night. When should you be concerned? If you suddenly break out in a cold sweat, especially combined with dizziness, shortness of breath, chest pain, or nausea, this may be a sign of an impending heart attack. In such cases, seek medical attention immediately. What should you do? Don't ignore frequent episodes of excessive sweating without an obvious cause. Pay attention to other possible symptoms of heart problems. Get a medical checkup if sweating is accompanied by weakness, dizziness, or chest pain. Cold, clammy sweating without a clear reason is not just an inconvenience. It can be a serious warning sign from your body that should not be ignored. Sign number 8. Heart rhythm disturbances, arrhythmia. If you start feeling irregularities in your heartbeat, sudden speeding up or slowing down of your pulse, it could be an early sign of cardiovascular issues. How does this manifest? A sensation that your heart is skipping, missing beats, or beating too fast. Unexpectedly fast heartbeat, even at rest. A fluttering or pounding sensation in your chest. Weakness, dizziness, or breathlessness during an episode. Episodes of anxiety or panic related to changes in heart rhythm. Why does this happen? Arrhythmia can occur when the heart doesn't get enough blood and oxygen due to narrowed arteries. This causes disruptions in the electrical impulses that control the heartbeat, leading to an irregular or unstable pulse. When should you be concerned? If rapid or irregular heartbeats occur without a reason. If episodes are regular and last longer than a few seconds. If arrhythmia is accompanied by dizziness, weakness, chest pain, or shortness of breath. What to do? Check your pulse. If it's too high or irregular, record the readings. Avoid caffeine and stress if you notice that they trigger arrhythmia. See a doctor, especially if episodes of rapid heartbeat are becoming more frequent or are accompanied by other symptoms. Get an ECG, heart monitoring, and blood tests to identify potential disorders. Heart rhythm disturbances may seem minor, but if they occur regularly or are accompanied by weakness and dizziness, it could be an early signal of serious problems. It's better to check your heart in time. Sign number 9. Nausea and digestive problems. If you frequently experience nausea, stomach discomfort, or a bloated feeling without a clear reason, it may be related to heart issues. Although such symptoms are usually associated with stomach or intestinal problems, they could also be precursors to a heart attack. How does this manifest? Unexplained nausea or indigestion. A sensation of fullness or heaviness in the stomach. Frequent belching or a feeling of discomfort in the stomach after eating. Reflux, heartburn, or vomiting without a clear cause. Why does this happen? Before a heart attack, the body experiences disruptions in the autonomic nervous system, which affects the digestive tract. The brain receives signals of stress, and digestive processes slow down, leading to nausea and indigestion. When should you be concerned? If stomach discomfort happens suddenly and is associated with other symptoms, chest pain, dizziness, shortness of breath. If you often feel nauseous without obvious causes. If discomfort doesn't go away after taking antacids or resting. What to do? Consult a doctor if nausea is persistent or occurs alongside other symptoms. Avoid heavy meals if you notice these symptoms, and eat smaller, lighter portions. Be aware that stomach problems can mask heart issues, and a checkup might be necessary. Nausea is rarely a primary symptom of heart issues, but if it appears along with other signs, especially chest discomfort, don't ignore it. It's better to get checked out in time than miss an important signal. So, we've covered 9 silent signs that may appear a month before a heart attack. It's important to remember that our bodies often send signals that we might overlook or dismiss as ordinary fatigue or age-related changes. However, ignoring these signs can lead to serious consequences. If you notice even a few of these symptoms, don't delay a visit to the doctor. Early detection and treatment can significantly increase your chances for a healthy future and prevent more serious health problems. Please take care of your body and pay attention to its signals. Your life and health are your responsibility. If you liked this video, please give it a thumbs up and subscribe to the Wellness After 50 channel so you don't miss other helpful tips on maintaining health in later life. Also, share this video with your loved ones. It could help someone recognize symptoms in time. Take care of yourself and stay healthy.